My name is Mike Buckley, and I'm the director of the Center for Socially Relevant Computing, and I teach undergraduate courses at the University of Buffalo.
So that's why I haven't been kind of lax on getting things done.
That's why I
The core concept of this project, actually right now it's 20 separate projects. Of my undergraduate senior level project students are tasked with improving the quality of life of some person or group. It's their choice. They have to find the project. So what happens is that they seek out people in need, and then they use cleverness, hard work, and technology to improve their quality of life. In the past, we've keyed on the handicapped population, medical population, medical providers, EMTs, firefighters, first responders, people who can benefit from technology.
Actually, that could be your motto. You could say, it's not cancer, it's better.
It got serious 5 years ago when Chris Schindler, Dr. Schindler, another professor in the department, came to me with a problem. His mom was a nurse in a skilled nursing facility. And there was a gentleman in that facility who had lost the ability to speak. He was 43 years old at the time. At 27 years old, he had suffered a stroke. And although he could think and he could move his arms, he was wheelchair bound and couldn't speak. And he communicated with his nurses and social workers by pointing to letters on a sheet of paper. And we thought we could do better than that. So we tasked our students with really just moving that sheet of paper to a computer so that when he tapped on the computer, it would speak for him. And that started an augmentative communications device that is still in production and still being used. It's used by about 50 people around the country. And my students are still working on it. That was our first project. Since then, we've got remote control wheelchairs. We have systems that monitor the vital signs of firefighters during an incident. We have the ability we give the quadriplegics the ability to surf the internet using only a head switch.
Oh, and it slows down. That's nice. Yeah, it's nice.
An animated, we call it a talking head that greets elderly patients in the morning and asks them to take their medication and take medical readings.
And then you actually just hit play.
I'm sorry to tell you that you have been diagnosed as suffering from what we call angina pectoris, which appears to be mild.
The medical school has an automated patient that students can take readings on as if it's real, and we build the instruments for that animated computerized patient.
Hello, my name is Zachary Marzak.
I'm Trevor Johnson.
I'm Kevin Hake.
And Fritz Sticht.
And we are MedSim Technologies, and we are developing hardware that can be used in with simulation medical devices. So to hook up our HAL device, just kind of show you, this is just our HAL thermometer with a little probe here.
Alright, this is a Gamard HAL 3101 human patient simulator. He's a high fidelity mannequin, which means that he's a mannequin that's controlled by a computer. He has realistic pulses, he has heartbeats, he has breath sounds, and we use these mannequins for the UB students to come in and practice their healthcare scenarios on these patients. The idea that we practice on mannequins lets them make mistakes in the simulated environment where it's safe to do so. One of the issues that we have in breaking the realism of this environment for the learners is that when they go to take a temperature, you're obviously not going to get a realistic temperature with a mannequin. So they can put the thermometer in their mouth, but they're not going to get a proper reading on the LED screen. So in the normal environment that we're working in right now, we actually have to talk over our PA system to tell them what the temperature will be on that reading. What they're creating for us is a thermometer that we can control through the computer.
It's a Bluetooth connection. So we actually build a special thermometer. So from a control room like this, you can just enter the data and send it out to our device. And to the student, it looks like they're just taking the real temperature, as if we want it to seem like a real instrument.
With this device, we're going to be able to take a normal temperature like we would and then push the temperature we want from the control room. So right now I'm going to take the temperature, put it in, and we'll do it again. We're going to wait. And we get our temperature of 101 degrees Fahrenheit or 40 degrees Celsius, 40.7 degrees Celsius.
I believe this work is important because it fits nicely with the education of undergraduates. This lab and the courses I offer tend to motivate students without me even trying. And the college students who work here respond really well to the people that they can help. The second part of that is that right now is a good time for technology to address these problems because technology hasn't addressed these problems yet. We find relatively easy solutions to very complex problems in the handicapped community, and we're doing things that nobody has ever done before.
Is this better boobs, guys?
She looks like Pam Anderson, man, or Dolly Parton. You should cut them down a bit.
I put bones in her boobs just for this.
Bones?
Wait, what?
The impact, I think, has actually been more on the undergraduate students. On the field, every time we write a paper or proposal out of this lab, it gets accepted. And the computer community is kind of taking notice of the work being done here in Buffalo. In fact, the term socially relevant computing was invented here and is used nationwide or worldwide right now. In Buffalo, and our lab gets the credit for that. There's a couple of universities. I know Rice University, Seattle University, and George Washington University are all starting programs in socially relevant computing, or at least laboratory work in that. So the work is sort of expanding. Microsoft Corporation has asked us to host a website, a community website for students who want to get involved in such projects, and community groups who need such projects, and industry groups who want to donate to such projects. And so right now it's really building. I've written a couple articles. Chris Schindler has written a couple articles. We've been appearing in magazines, newspapers, and on news reports. So people are paying attention. The future of this work is that we're going to get more projects than we can handle. Remember, it all comes down to individual projects helping individual people. We're working on 20 systems right now. There's probably 50 I know of that I can't get to, and I can easily find 100 more. So the future is that we keep using student creative energy to address the needs of this very deserving population.
Here are a few options. You could call your healthcare team and see if they can help out. You could also call the ABA, which has a number you can call and talk with someone there about how you're doing. Or maybe you could talk with your friends or family about this. Regardless of which one you chose, just know that people often find they feel a lot better after they talk through some of these things. Which one sounds good to you right now?
Me choose such hours. Like that will